First of all, we don't do the vaccine development process justice. Yes, the vaccines themselves were developed fast, but for 15 or 20 years, the basic science that underlies these new mechanisms of making vaccines were under development. So we don't really count that very much. Uh, Now we're in the 21st century, and there were ways to apply this technology that had been waiting for a problem to solve the problem. And so a lot of attention was devoted to it. And then we added several things. People literally worked day and night. Number two, the government put funding into it. That removes a lot of barriers in time in raising money. And then we did some things rather than in sequence, we did them simultaneously. Look at it this way. If you and I were the chief executive officers of a large vaccine company, we would wait until the clinical trials were finished to see whether the vaccine worked before we started to manufacture the vaccine in a large amount. But what you and I did as taxpayers is go to those companies. We were so confident these vaccines were going to work. We told them, start manufacturing the vaccine even before the clinical trials were completed. So we did those things simultaneously that usually we do in sequence. And thereby, oh, well, of course, we won the lottery, to use Bob's term, because we had two vaccines fabulously effective and very safe. And each company had a warehouse full of vaccine ready to ship. And that's how we were able to reduce the time. I think the name Operation Warp Speed actually was supposed to reassure people about how quickly we were working, and it actually made them a little bit wary. But so we've tried to convince people that once these vaccines were presented to the Food and Drug Administration, they were investigated and reviewed very meticulously. There was an external advisory committee that took the data apart and put it back together again. They are traditionally very tough, and it passed, both vaccines did, with flying colors. So on that score, I think we just need to tell this story and provide some reassurance that these vaccines are safe. And then we did these large trials, and now we are administering these vaccines. We'd like to administer them more, but to millions of people. And our surveillance for adverse events is very good, it's very thorough,